TMJ patients are complex because they come with a multitude of different symptoms. Sometimes it's very obvious: headaches, pain, clicking, popping, ear ringing. Other times there are very few symptoms, but the damage to the joint or the teeth can be extensive. One of the common signs I see that is often missed by dentists is localized bone loss. Most dentists, when they see bone loss, automatically assume that it must be the patient not brushing and flossing adequately. They will encourage the patient to take better care of their teeth via oral hygiene tips. But there is something that is so often missed when it comes to bone loss, especially when it's only on few teeth. Many people have heard the term malocclusion, especially when getting braces or aligners to straighten out their teeth. But malocclusion on a micro scale is a totally different issue. When looking at obvious malocclusion like rotated or crowded teeth, one can see the aesthetic and functional issues that result from this type of alignment or lack of. But when teeth appear to fit together, appear straight, even, and the bite also seems fine, most clinicians ignore the micro-occlusion or micro-malocclusion that may exist, and if left untreated can cause severe damage, even loss of teeth over time. It is important to recognize that even the slightest misalignment can have devastating effects, and attention to details, especially when key signs are present, is critical to a correct diagnosis. Localized bone loss is a common sign of micro-malocclusion. When a couple of teeth are slightly off the correct angle, they hit each other either on an incline, which is incorrect, or prematurely. When that occurs, forces must be applied to close the bite completely in order for other teeth to touch. Studies of parafunction have shown that a displacement as low as 0.1 mm can cause side-to-side movement of the teeth in contact and result in surrounding bone loss, especially in clenchers or bruxers. In addition, such displacement can recruit single motor units within the lateral pterygoid muscle, which is one of the stabilizers of the lower joint. And remember, a large portion of lateral pterygoid is anaerobic and susceptible to fatigue. Even the smallest interferences are often the trigger for sore teeth, muscle pain, and localized bone loss. Treatment of this is fairly simple once a correct diagnosis is achieved. Checking for and adjusting out the interferences by 3D visualization so the teeth come into contact on biting down but not on sliding laterally will prevent further damage and eliminate muscle pain. Leaving this untreated and telling the patient